Hey everybody, I guess I'll start out this week with a quick update since I've been away for surgery the past week or so. This is my new chest. A little over a week post-op. I'm still putting bandages over my nips, and I just got to see my chest for the first time yesterday. It was all wrapped up and stuff for the first week. And I'm just, I still can't believe it. It's amazing to not have boobs anymore. It's looking pretty gross, and I still have like all sorts of, bandage stuff attached to me and everything, and I'm really, really sore, and I'm still hunchy, because everything hurts. But, I'm really happy with the results. I went to Dr. Garamoni in Sunrise, Florida, and yeah, I really like the placement of my scars so far. I did a lot of upper body working out beforehand. It seems to pay off because scars seem to be right underneath my pecs, and they're pretty defined. This side's a little poofier than the other side right now, but some of that is swelling that'll go down, and some of it is just that my left side is a little more developed than my right side. Here's some side view. You can see I have terrible posture, but I'll hopefully work on that. I also have a lot of stomach going on at the moment. I lost about 15 pounds since January, trying to get ready for surgery. And like the last week I've been doing nothing but sitting on my ass and eating, so well, we'll get that back in shape after this is done healing. So yeah. Yeah, I'll show you some more of like my nipples and stuff once they look less gross. And alright, now on to the topics for the last 2 weeks. Alright. Okay, so, first topic on the thetguys is, dealing with homophobia and or transphobia. I have actually been really lucky in my life, to have really accepting parents and accepting friends and living in my queer bubble. Pretty much all of my friends are queer, and the places I go to and the events that I participate in are very queer friendly, so I haven't really run into a whole lot of homophobic or transphobic people or remarks. I would say like probably the most common is like comments, like either overhearing other people say things or being in a situation, even within queer space, trying to explain the trans thing to people who don't understand it fully. But I don't think it's necessarily, I mean, some of it is homophobic and transphobic, but some of it's just coming from a place of ignorance and wanting to learn what it's all about. I mean, there definitely are people who, just say things to be mean, but most people just don't understand. So I'm pretty open with answering anybody's questions, even if they seem like stupid questions. So, while not a whole lot of queer people have the patience for that, I think that it helps me in that people who, do make comments that are out of ignorance can learn why that's not appropriate, and people who want to learn to be good allies can ask the stupid questions and get intelligent answers instead of just getting blown off, or like told that it's inappropriate and they don't understand why. So I'm very much like of an educational perspective in terms of that, and I really haven't had any sort of like physical or intense verbal harassment or anything like that against me. So, I mean, I hear horror stories all the time about people being attacked either verbally or physically, or people getting disowned by their families, or kicked out of their housing, or like all sorts of things. But luckily, knock on wood, that's never happened to me so far. So hopefully it won't. And then this week's topic is talking about binding. So I just had chest surgery, so I don't have to bind anymore, thank God. Oh my God, it's Florida in the summer, and it sucks so bad to bind. Especially I had pretty huge boobs, so that was no fun at all. Prior to getting my surgery, I had been binding for about 2.5 years, which was not fun for my boobs, and but apparently it made it pretty easy for me to have surgery because they were pretty floppy, and it was just basically taking off the excess dangly bits because they were pretty flat, and I mean it did cause some physical changes. I, usually flatten them out like this and then pull them towards my side, so they were really, floppy and dangly. Even if I did end up deciding that I didn't want surgery or something like that, they really weren't, that much to look at. They weren't perky or anything like that. And they really weren't to begin with prior to binding, but, I mean, like, the feel of them did change with binding and having that pressure on them. I mean, it's harder to breathe when you're binding, depending on, how hard you bind. I mean, I wasn't, like, out of breath all the time. I could, go through daily activities without being short of breath, but it was harder to work out and do more strenuous activities without having to, like, pull my binder down or, like, make sure it was fit right, or, making sure the uniboob wasn't there, trying to keep it from rolling up. It would, sometimes when I had, like, the double front, it's not so bad with the muscle tee, but the double front kind of cuts into your hips, at least for me. I had, like, wider hips at the time, but still, that was painful. I had a lot of back trouble. The middle of my back is always really crunchy from slouching and from the binder pulling down. I still have really terrible posture that I have to work on. I don't know whether this is a binding thing or not, but, like, I realized that my ribs kind of, like, stick out right here a little bit. They're kind of, like, pushed in here and, like, stick out here a little bit. I don't know if you can tell or not, but, I don't know if that's a binding thing or not. I've heard some people say that their ribs change shape when they're binding. I didn't think I was binding that hard, but I mean, it possibly could be from binding. I haven't broken any ribs or anything like that. I don't really extremely bind, just, the compression shirt, and that's it. And, I mean, I was pretty careful to get a shirt that would compress my breasts enough that they could pass for male, but not enough that I was, like, smushing everything else, because it would be really uncomfortable for long periods of time. So yeah, like, long-term effects, I guess, would just be, like, learning to have better posture, and possibly, like, the rib cage shape-changing thing. I mean, I'm hoping it might, like, even out a little bit, but I'm not even really sure whether that was a pre-binding thing or not. I never really noticed it before, but I don't know. It's been a while. So yeah, I mean, overall, I don't think that binding is dangerous if you do it right. With any sort of thing that you're doing for appearance, like wearing high-heeled shoes or whatever, there's an amount of pain that you're willing to give up to look the way that you want. So, I mean, it's up to every individual to determine that threshold for themselves. And for me, it was better to bind for 2.5 years than to support my huge breasts that betrayed my gender identity. So yeah, I am caught up on the thetguys now, and I will be back next Thursday on time, and thanks for staying with me. See you later. Bye.